Welcome to Uncut with Lucia. Today, we are thrilled to have Dr. Corona with us. Dr. Corona is a medical doctor turned author who has recently published the Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide. 30 years in the making. So, Dr. Corona, you are very welcome to Uncut with me, Lucia.
Thank you, Lucia. It's a pleasure to be on with you.
Thank you. This is the third time that we are
Third
talking.
time's a charm.
It's an honor and a pleasure to have you here again. I was researching about you, and I see that you started your career in family medicine before shifting to psychiatry. So what motivates you for this transition? What motivates this transition?
Well, when I chose family medicine for a career, I didn't know exactly what I wanted to do because I liked psychiatry, I liked pediatrics, I liked adult medicine, I liked OBGYN. I liked everything, and I just didn't know if I wanted to do anything full time. So I decided to be a family doctor because I thought I'd get a little bit of mix of everything. And I enjoyed it very much. But in the 1990s, I started my practice in 1992. And in the 90s, some new medications came out, and I became really fascinated by what I was seeing happening. There was a medication called Effexor that came out, and most people have heard of SSRIs like Zoloft and Lexapro, but this medication not only balanced serotonin, but also norepinephrine. So not to get too technical here, but what I discovered here was that this medication was helping not only their depression and their anxiety, but their pain. And so I started seeing pain reduction, and that's that. And people will come back and their headaches were gone, and their back pain, and their irritable bowel syndrome, and their fibromyalgia. So I started seeing a link between the mind and body, and I realized it was a chemical link in the nervous system. And so I started exploring that in the 1990s, and I started really getting more and more into the medications and how to combine them and how to use them in certain ways. And so by the year 2000 or so, I kind of had to make a decision. I was getting so busy with what I was doing in psychiatry, and then I was getting too busy, and I had to make a choice of which way to go. And I had to follow the path of mental health because I also realized that I was making a bigger difference. It was more exciting to me. It was a more exciting field. I was getting people dramatically better and very quickly, and so it was just more interesting and I thought more impacting on my patients' lives for me to follow this path that led to the writing of the books, and so I just that's kind of what drew me into it, is just the excitement of seeing like what medications can actually do for people. And I think there's so much anti-medication mentality out there. But when people really understand what medications are about, what they do exactly, how they work, and I explain to every person, here's what I'm thinking is going on, and we're going to try this. If it works, great. If it doesn't, we'll stop it. But there's a lot of that goes on in this field. You have to be open. The patient has to understand what I'm trying to do, and my patients are very satisfied because I've gotten really good at understanding like what's going to be the right fit for a person, what will make them better very quickly. And I usually get my patients better within, 1 or 2 visits. It doesn't take me long.
Oh, it's good. Very good. So I knew that your background in family medicine influenced your psychiatric practice. And yes, you were talking about medicine, and I remember a long time ago, a doctor gave me diazepam because I was complaining about pain. And I said, but diazepam is not only for, let's say, anxiety. And I said, no, it works also in the muscles, for the muscles. And then I said, well, okay, wonderful. So it's good to know that sometimes medication can work for body and also mind. So, Dr. Paul, we are seeing an increase in mental health issues. Of course, there are many reasons for this rise. However, some people might not be receiving the right treatment. What do you think The first question is, what do you think are the key factors contributing to the increase in mental health issues?
Well, I think that just our modern world, I think things are getting more stressful. I think the pandemic really did not help mental health at all. And everything is just, in our country is not doing well. The world is not doing well. I think people get anxious when they look around and they see, they see there's such anxiety out there about so many things, and then that leads to mental health problems, and people aren't getting the right treatment. I mean, you bring up a good point about the diazepam. So, and I think what I learned, I think the reason I really learned what I learned is as a family doctor, I was really understanding the body. And psychiatrists normally they don't really understand the body. They don't train in that. They don't really pay attention to it. So diazepam helps exactly because it's a tranquilizer. So it helps the muscle tension. It also helps the anxiety. So that's an example of a treatment, but it's just kind of I call it a Band-Aid treatment. In other words, it's not getting down to the root of the problem. It's just throwing a Band-Aid on top of it. And that's fine. I mean, diazepam works. I have some patients who take it. It's not about that. But if someone is having pain associated with stress and mood, I treat the core of it. So I use the psychotropic medications in a way that balances people's neurochemicals, and when you do that correctly, the anxiety goes away, the pain goes away without pain pills, the anxiety goes away without diazepam. But it takes treating it on the very and the at the nerve cell, within the nervous system, these imbalances happen. So the medications I use actually correct the imbalances, and when the imbalances are corrected, then the mood gets better, the body gets better, and so it's also with writing my books, I really wanted to kind of teach doctors because there's not a lot of doctors out there, I've found out, that really know what they're doing and really know how to treat it. And the need, you mentioned mental health, the need is so great out there. There's so many people suffering, and they don't know what to do because they might go to their doctor or their family doctor, and the family doctor doesn't really know what to do, and so there's a lot of unnecessary suffering out there, unfortunately, and that's what really has driven me to do what I do and to write what I've written now, actually 6 books. This is actually my 6th book. What's driven me to write and to do this is because I want to help as many people as I can, and I want to be able to help other doctors to teach them how to do this.
I think it's very important to say is that mental illness is nothing to be ashamed of.
Yeah.
Yes, doctor. And I was also seeing that more than 1 in 5 adults in the US has a diagnosable mental disorder. It's a lot.
Yeah, and mental illness is physical illness. It has to do with the brain. There's nothing to be ashamed of, like you said. It's not your fault. It's what causes it. Typically, genetics. Normally it runs in families. Number one. Number two, it's affected by hormone changes. So puberty, menopause, after childbirth, which is postpartum. So women have a lot of also hormonal changes, premenstrual changes, like around the mood around before the period, and so genetics, hormones, stress. There's a lot of stress going on. So if you're faced with a lot of stressors, that throws things off. So these things actually throw the chemical, or the nervous system out of balance, and that's the problem. Is when the system's out of balance, it leads to all these problems. And unfortunately, I think people, when they hear mental illness, they get very defensive and well, I'm fine. I'm not crazy. What are you calling me crazy? And people don't understand that it's not crazy. It's you have something that's treatable, and it's just like any other illness, diabetes, blood pressure, whatever. But it has to do with your brain. And I think what people don't think is as real because there's no test. There's not a great test where you can't do a blood test or do the scan of the brain and try to figure out what's going on that way. That's not where the problem is. You can't see it on other tests, so it makes people think it's not as real. But it's very real. It's very real. It's extremely common. And the good thing about it is it's treatable. So if people just learn, if people just not be so defensive and go to try to find someone who can help you. But the problem is finding somebody who can help you, and that can be a challenge to find someone who really understands and knows how to treat this properly.
Yes, the difference, doctor, is that you don't see only the mind or the body. You work these two important systems in as a whole, not only one brain, body, because they are linked. Yeah, it's the brain controls the body, and also the body makes a lot of influence in the
Yeah.
brain. Regular physical activities, for example, can improve your mood, it can decrease your anxiety. So it's more than proven that it's important not to see only one organ, but the whole body. And this is what I see in your work, doctor. Congratulations.
Thanks. And bring up a really good point. It's not just about medications. I work with my patients to make sure they're physically active, make sure they're getting adequate amount of exercise to help with their stress. I tell them, if you have issues you need resolving, uh, get some counseling for that. If you have traumatic issues from childhood or things from the past that are not medications aren't going to help that. So that's what I do with medications, but I don't have all the answers, and I think that I try to find the right individualized approach for each of my patients, see exactly what do they need. Sometimes they've had that. Sometimes they're exercising already. They've already gotten counseling, and the therapist will send the person to me saying, okay, this person needs medications now. and that's the thing that really turns them around. And so yeah, so it's exciting what I do. I love seeing the results. I love seeing what my patients their lives turn around for the better. And that's what drove me into doing this, is because there was no other area of medicine I could see that was this exciting, and this impacting on people's lives.
Yes, exactly. And Dr. Corona, tell us a little bit about the Corona protocol. For example, for whom it was designed. And yes, a little bit more, please.
Yeah, so to get to my current book, my when I first started my book writing was early about 2002. So I wrote three books over 12 years, healing the mind and body. I call it the trilogy. It's a three-book set, 1,200 pages of material. After those three books, before I even thought about writing this book, I knew at that point, I need to teach. I need to teach doctors this because they don't understand it. Most of them don't know it. So I wrote two books for doctors. The book, the fourth book is the Corona Protocol Prescriber's Guide, and the fifth book is called the Corona Protocol: Three Secrets to Success. So after writing those two books, then I thought, okay, now what do I do? So, because I need to write a book that's very impacting, because for me to teach, I need to do more. And so with this book, I decided to write a storytelling book. The Corona Protocol is my approach to things, and so how I approach a patient individually, and how do I decide what to do and what to do the second visit, what to do the third visit. So in the Corona Protocol, I tell 30 individual short stories about people and their lives, and with the storytelling, I'm able to explain to people the protocol. So most of the cases I talk about medications from start to finish, from the beginning of the case to the end of the case. There's a lot of happy endings in the book. There's some sad endings. So not everything is a happy ending in life. And so I basically, so most of the stories though really show how the Corona Protocol actually works in each case. And so I wrote a variety of cases to try to show different types of people and so I try to make a real variety in this book to really explain every aspect of what I do, every diagnosis that I work with, every medication class I work with. So it's a very, very complete book. And then I also tell, excuse me, I also tell my story in the book about from start to finish about some of the things we talk about today about how I learned all this and along the way, and then I share a lot of personal things in this book too, a lot of difficult times I've gone through, and so I'm very open in the book about my journey, and it's not always been, it hasn't always been easy. It's been some bumps in the road along the way, but thankfully I've been able to get through those and survive it. But yeah, but I really am happy how the book came out. People are raving about it. I have a 5-star rating on Amazon. I get all these people contacting me about it, and they just love it. And I'm so happy to hear that because it took 5 years to put this book together. And I went over it again and again to make sure everything was just right. And once I was happy with it, then I released it. So, but yeah, it's different than my other books because I've always loved fiction growing up. I'm a fiction reader, and so I always wanted to write fiction. And my first 3 books are nonfiction, but this was mostly fiction. It's mostly my imagination. Some of the cases are based on real patients. Some aren't, or somewhat my patients. But there's not one person that's one case. There's maybe a variety of different people in one case. But yeah, but I think the storytelling part is really what people love about this book, and that's what they tell me.
Yes. Yeah, storytelling is just much better when you're learning a new
Yeah.
subject. And I know that writing is not new to you, as you have written many books and also training manuals for healthcare professionals. But however, writing a book for a broader audience is different than for when you write manuals. Did you have any challenges you face? Did you face some challenges when writing this book? Because it's kind of a little bit of fiction. You have stories. So was it easy for you to develop these stories and make it become a book?
I thought it was really, I thought it was fun. Um, I needed to write a book like this because, for doctors to want to take the course, I want to teach doctors like it is so I thought I need to write a book that really doctors will like, not just patients, because doctors learn by we call case studies because the doctors see stories all day. We see stories every day in our office. So I wanted a book that could relate to patients, also relate to doctors, and so that
Mhm.
all audiences would really enjoy it. But yeah, but the challenge, I mean, the challenge with writing is it's exhausting. I mean, I had a lot of fun though. Writing this book was a lot of fun, even though it very time consuming. It took a lot out of me. It was, and at the end of the day, it's just so satisfying to finally have it come out, and my just sticking with it and not being satisfied with like, oh, let me just get it out. No, I'm not done yet. That story needs more, and this story needs a little bit change there. Or these 2 stories are a little bit too much alike. I need to make a change in this one. It was a lot of that went on, and so but the challenging of writing, over 20 years now, 22 years of writing, is that you got to stick with it. You can't just give up, and you have to be very, very aggressive with it. But now the good thing now is I feel very relaxed because I'm not writing anymore. I'm done writing. I don't want to write again.
No, you will give up writing, Dr. Paul.
I've done enough, and I now I want to now my next thing to do is I'm trying to figure out how to start like a training course online, do like an online training course with doctors. So that's my next goal, is to try to do that. And so.
Yeah, this sounds interesting, but it's only for doctors. Can we, let's say, regular people watch this course when you create it, or it's just specifically for doctors?
Yeah, well, the two books that I haven't released yet, I've finished them, but I haven't released them yet, and I'm still picking through them. I'm still trying to perfect them. I'm not, but they're books that are very, very detailed. So I don't think the general audience would be really that interested in these two books. Maybe they will be. Maybe would be surprised. Maybe people want to read that type of material, but it's extremely detailed. So I think it's really those two books. They're a little bit shorter books than this one,
Mhm.
but those two are really more for the hardcore audience who've already read my first three books, already read the Corona Protocol, and I think if you read all those four books, then I think you're going to have an understanding of these two books. And it's not just doctors. In the United States, there's a lot of there's a lot of physician assistants and nurse practitioners. Now, these are people they're not medical doctors, but we call them mid-level practitioners, but they do have training to prescribe. But just like a lot of family doctors out there, I think their training is okay, but it could be better, So my teaching is going to focus on primary care doctors, like family doctors, and then PAs and NPs. That's going to be, and if psychiatrists are interested, to take it also, that I think that would be nice if maybe they'll realize that I have a different perspective than they have, and that they may be interested in learning something from me.
Mhm. Wonderful. Sounds great. But I still don't believe you stop writing. And Dr. Paul, where can our viewers find you and your books? I saw that your book is on Amazon and it has great reviews. I will definitely be checking it out. So share with us where we can find you, please.
So my first three books, Healing the Mind and Body, the trilogy, is found on Amazon. They're sold separately. My new book, The Corona Protocol, is on Amazon, Barnes and Noble, and Walmart. And that's where they can get it. And that we have it on ebook, soft cover, and hardcover. We don't. Everyone asks me, we don't have an audio book. I get the question all the time. At least not yet. We don't have that. And as far as I have a podcast called The Dr. Paul Show, and that's on Spotify. I try to keep it up to weekly, but I get so busy sometimes I don't always do it weekly. And you can follow me on Instagram, X, which was Twitter, and Facebook, and my website is drpaulcoronamd.com. So that's DR for doctor, Paul Corona, like the virus, MD for medical doctor.com. And so that you can always get a hold of me. And I'm also, if people out there are frustrated because they're not getting the care they need, the doctor doesn't know what to do, which is very common, and they're just not getting better, or they're getting worse and they need help, I am available. I do see new patients virtually from out of my area. So I do that a lot out of state, and I haven't done out of the country yet. I'm not sure how that would work because there's a different pharmacy system there.
Mhm.
But at least in this country, I am available to see people, and just be in touch with them on virtually or by phone. So, which has gotten very, very popular since COVID, since the pandemic. There's a lot of the care has gone to phone visits or virtual visits.
Yes, it's good to know because nowadays it's so much easier to talk to a doctor. Online is the same because you're having the doctor there giving you plenty of attention. So, Dr. Corona, it's always a pleasure to speak with you. Keep doing this amazing work you are doing, helping people. And I hope we can meet again. I can talk with you again.
Yes, absolutely. I'd love to be on it. But this is we don't have to stop at 3. We can keep going.
Yes, yes. I could stay here for many hours. So, Dr. Corona, thank you. And for you that are at home, thank you very much for your time. And Dr. Paul Corona's contact will be in the episode. So I'll see you later. Thank you.
Sure. Bye now.
Bye.